From LPM,
Louisville Public Media.
Welcome to On Track. I'm Aisha Jaffer. According to a 2023 report from the U.S. Department of Health and Human Services, 14 out of every 1,000 kids in Kentucky will experience some sort of abuse or neglect. That's compared to the national average of around 7 kids per 1,000, making Kentucky the 4th highest state in the nation for child abuse and neglect. So why are the numbers so high here, and what's being done to stop abuse and support families? Joining us is Elea Fox. She's the president and CEO of Family and Children's Place, a Louisville organization that's dedicated to preventing child abuse and fostering family well-being. Elea, welcome to On Track.
Thank you so much for having me here.
So how do you define child abuse? What falls under the umbrella of this term?
Sure. So the report that you're referring to is the National Child Maltreatment Report, and that report includes both neglect and abuse. In Kentucky, about 51% of the substantiated cases involve neglect. So neglect is something where a child's needs are not being met, whether they're physical, medical, emotional. They may lack food, they may lack stable housing, they may lack emotional support, school readiness, even being registered in school. These are all things that could fall under neglect. Abuse tends to refer to something with intentionality, whether that's physical abuse, sexual abuse, human trafficking, other instances of actions against a child that a parent or caretaker is taking.
Thank you for defining those, because I think it's something that we don't always talk about. So then neglect and child abuse, those are two different definitions. Mm-hmm. So when child abuse is identified, how is that typically handled within the legal system versus neglect?
Sure. So both are illegal. Both have long-term negative effects on children. And in Kentucky, there's a lot of research that suggests that it has detrimental effects on the state. I mean, really is a public health crisis in terms of long-term health issues, long-term mental health needs, cognitive delays, just a lot of challenges that can result in those early childhood experiences. So in the case of neglect or abuse, both are investigated, both are illegal. And at the Family and Children's Place, we primarily focus in terms of our child abuse efforts around substantiated cases of abuse.
So are these all treated as well as like criminal cases because you say they're illegal, or does it sort of depend on the situation?
It depends on the situation, and it depends on the findings of the investigation. And I think something to sort of keep in mind, too, with Kentucky's high rates of abuse and neglect, again, these being different things, are that we just have a lot of social and environmental factors that can contribute to neglect and abuse. So in Kentucky, the biggest factor was substance use. And as a state, we have a higher rate of substance use than many other areas of the country. Domestic violence and financial hardship were then the second leading causes of maltreatment. So, but in terms of abuse, abuse happens, unfortunately, across the board, across demographics, across locations.
So is there anything, like when we're talking about abuse in Kentucky, that's socioeconomic, that's like specific to why those rates are so high?
Well, the number one indicator from the maltreatment report was financial hardship. And there was a really strong correlation, I want to say about 70% of cases of maltreatment had a correlation either with financial stress or financial hardship. And so, the ability to have stable housing, the ability to provide meals, clothing, medicine, a lot of that results in neglect. But then in addition to that, financial hardship is a major stressor for parents. And so outside of the means to provide, there is the stress of trying to provide. And financial stress is a major factor in divorce and family discomfort. And so it really does play into both abuse, neglect, and just parental stress in general. Another thing I think that's worth noting in Kentucky is that over 50% of all of the substantiated cases took place with a parent, a mother or father in the household. So things that cause parental stress cause hardships on children.
So, I mean, also, though, just thinking about like these higher numbers, how should we interpret that? Because does it necessarily mean more children are being harmed, or could it reflect changes in awareness or how cases are identified as well?
I think to some extent that's a good question, and we don't entirely know it. So this year's report had a change in some of the standards, and so the baseline has changed year over year. And this report is also a comparison of us to other states. And every state doesn't have the same reporting mechanisms as Kentucky. Every state doesn't have the same regulations. So it's not entirely an apples to apples comparison. I mean, for example, according to that maltreatment report, the highest rates of maltreatment are taking place in Massachusetts, and the lowest rates are taking place in Mississippi. I think one could question that data. The positive part with Kentucky is that it did also show a reduction in abuse. While we remain way too high, fourth highest in the nation, double the national rate, it did show progress in terms of over the last 5 years, there's been close to a 25% decline. And in addition to that, Kentucky has taken on a lot of initiatives that not every state has adopted. I mean, we've had a lot of legislative work around increasing awareness, prevention efforts. And so sometimes increased reporting is not necessarily indicative of increased abuse. It just means, like you said, there's increased awareness in the community. And Kentucky's a mandatory reporting state. So in Kentucky, every person who has reasonable suspicion that a child is being abused or neglected has a legal responsibility to report that. Not every state has that requirement.
So the mandatory reporting, that applies to everybody, not just certain professions or anything
right,
like that.
That applies to everybody. So, of course, with those that work with children directly, there are even higher expectations. But yes, every citizen in Kentucky is a reported mandator. So if you suspect that a child is experiencing neglect or abuse, we all have a responsibility to reach out. And in many cases, because half of these cases are taking place with parents, you may be that adult in their life. You may be that extra set of eyes that's seeing what happened. Many kids that are being abused live in isolation. So being an outside person who's there to advocate for that child and pay attention could be the difference in some cases between life and death.
So what are some of those warning signs that a child might be experiencing abuse or neglect?
Sure. Quite a few things. I mean, one is the most obvious is bruising, especially bruising in the face. It's not an area where children tend to get hurt as much as they may fall down or have, other bruising in their body. So looking for bruising, lethargic, not being well kept, having concerns about hygiene, a kid who just appears to be hungry. Sometimes behavioral problems may be a real indicator that something else is going on at home, and that's how the child is showing their distress, is that they're acting out in other ways. And the stability of a parent is just a huge factor. So if you see a kid who's exhibiting this at the same time that you see a parent who appears that they may have some other challenges and may not be stable themselves, that might be an indicator that something is taking place there.
Is there some sort of form of abuse or neglect that is most common in this state?
Neglect is the biggest form, but the data we have doesn't break out the types of neglect. And then that's followed by physical abuse,
right.
Sexual abuse.
You also mentioned human trafficking.
Mm-hmm.
And so is that pretty common in the state? And that's under abuse, right?
Mm-hmm.
Okay.
Right. So the rate of reported human trafficking in Kentucky is growing. At our Child Advocacy Center, I want to say about 3% of the cases we see right now are related to human trafficking. So Kentucky has the ninth highest increase of reported human trafficking cases, but again, that could be awareness as much as it could be other practices. And in the case of parents, that may be a person with a substance use disorder who is seeking financial gain. That could be an exchange of a lot of different things. And the state differentiates between labor exploitation and sexual exploitation in human trafficking.
Are there signs in that field that we can look for to see that is happening in our state?
Sure. Mm-hmm. Again, it's looking for things like isolation. In many cases, traffickers isolate their victims. So that's one of the biggest indicators. Of course, there are certain industries where this may be more prevalent, and the state has really taken a lot of initiatives to do more work in terms of examining those industries too. But in many cases, this is something that a neighbor may observe. This is something that a classmate or a teacher may observe, these kind of behaviors in kids.
So if someone suspects that a child is being harmed or at risk, what should they do?
Well, first thing, if it's an emergency, call 911. And if it's a non-emergency, call 1-877-KENTUCKY-SAFE-1. So 1-877 Kentucky Safe 1. That is the hotline for Kentucky where you can report abuse cases, and that will trigger an investigation within the state. Another thing that you can do just in terms of being a champion to children are if you have kids yourself, looking at talking to your school, talking to your extracurricular Boy Scouts, Girl Scouts, religious affiliation, sports groups, seeing what kinds of practices they have, making sure that they have training. CACs of Kentucky, which is cackentucky.org, has lots of resources available in terms of training that can be provided for educators and extracurricular activities so that you can be doing things to build a safe environment for your children, for your neighbors, and for everybody around them. So, and another thing I think is just important to keep in mind is that you can be that voice, you can be that other adult in a child's life. In many cases, children that are abused are very intentionally targeted, and they were vulnerable to the abuse because they didn't have an adult in their life who was paying attention. So be that adult in a kid's life who's paying attention. And it doesn't have to be because you're their caregiver or parent. You can be that neighbor, friend, teacher, community member who is a safe place for kids and paying attention to these things.
I really love that. I really love hearing that. And I'm just sort of thinking about like all the places that you're mentioning too, like places where kids are, the school, those infrastructure places. Are there things that are already required for prevention, and what kind of tools or programs even are in place in those kinds of spaces?
Yeah, there are a number of requirements and a number of community organizations that work to provide things like training, education, training both students and adults. And there are other mandates in terms of just background checks, like we talked about, mandated reporting. So there is a lot of work going in, and I think a lot of people across the state who are really committed to having a better support system. So again, I think, for people who are looking to be that voice, there are opportunities for you to do that.
Are there any organizations or anything like that that you can think of?
Sure. Well, Family and Children's Place, I mean, we have a number of services. And then we also work with many community partners that also are doing complementary work. So Family and Children's Place, we have 5 distinct services. And one of them is the Child Advocacy Center. And so if there are suspicions of abuse, and it's notified to Child and Protective Services or law enforcement, the CAC then coordinates that case. And so it's a complicated system where the kid is navigating prosecutors and law enforcement and CPS and medical doctors and their teachers. And so the idea is that they have a single place that is thinking about their well-being, there to be their advocate, that's child-centered, and that is doing all of this coordination. And so that's where we conduct forensic interviews, medical exams, counseling services, family advocacy, and a lot of work to help the child and a non-offending caregiver through the process of documenting what's taken place, if prosecution, is going forward, whatever kinds of services they may need to recover. So it's a major service that we have. Another one is visitation and parenting services. And so this is primarily children that are in foster care or children that where there's a case with Child and Protective Services where supervised visitation is needed. And in that process, in addition to supervised visitation, we also have a lot of parenting classes, a lot of efforts for family reunification. So with the goal that the kid can be safely returned to the home and that the parent is better equipped to take care of them. And from what we see, a lot of the cases are related to substance use and domestic violence. And so also just equipping the parent, coping skills, parenting skills, and resources in the community. Now, our other programs aren't directly related to abuse, but they are things that we do to prevent abuse. So these are just how do we build protective factors? How do we get to a place where we can put ourselves out of business on these other services? And so we have a program called HANDS. It's Health Access and Nurturing Development, run Greater Louisville Head Start program, and then also have school-based services. And so these are all things to equip parents and community members and children with different outcomes. So HANDS and Head Start in particular are important for abuse because in Kentucky, the number one population at risk for abuse is people that are under 4. And the single largest population is those under 1. So those early years and those toddler years are just critical years. I mean, just a lot of parental stress, a lot of parental uncertainty. So everything that we can do to give an extra set of hands to be there to help parents in those early years then reduces the likelihood of abuse and maltreatment later. So these are things like parenting classes, home visiting services, nutrition, how to teach positive parenting, how to build, relationships with your kids, early exposure to education. Those are all things that then down the road lessen the likelihood of abuse. So for our HANDS program, which sees hundreds of children annually, it's the largest HANDS program in Kentucky. We have less than 98% of our participants have no substantiated issues with abuse. They are much lower than the general population. So there are good evidence-based programs out there and a lot of research that tells us prevention works. And so we are trying to invest in kids right now that are in crisis and address the abuse that's taking place, but also always have a foot in prevention. And again, how do we put ourselves out of business? This is a public health crisis that has horrific, crippling, multi-generational impacts on people. And so anything we can do to end that is really a goal.
In all of that, I know you mentioned counseling, because I imagine mental health is a big part of it for both the parent and the child.
Right.
What's available there?
So our Child Advocacy Center has a counseling program that takes children through, the process. But we also connect with other partners in the community. We might work with 7 counties. We might work with local hospitals, make referrals, and do everything we can if we can't provide the service to then connect them with other local services.
Well, thank you. We'll be back in a moment. You're on track with Louisville Public Media. Welcome back to On Track. I'm Aisha Jaffer, and we are talking to Elea Fox, President and CEO of Family and Children's Place, about child abuse here in Kentucky. So I know we sort of touched on this, but just for clarity, like once abuse has occurred, what kinds of support or interventions are needed or available to help children and families heal?
Sure. So when a report has been made to Child and Protective Services or to law enforcement, that's the time when the Child Advocacy Center becomes involved. And this is a coordination between mental health professionals, medical professionals, often educators, social service providers, prosecutors, law enforcement, and a number of other public services, because there are just multiple things that are taking place. One is that there's an investigation taking place. There's work to substantiate and to document if this has taken place, to then potentially prosecute the offender. There's also then the recovery of the child and the other family members, where things would take place, either medical exams, counseling services, other family supports, and family resources for their long-term healing. So, and there are numbers of, like I said, numerous organizations in Louisville that all play into this in various ways, whether it is court advocacy, whether it's other nonprofits that are building networks, a lot of organizations that come together. But so if this is something that you're experiencing and you report it, there are people there to help that want to do this and are willing to be the advocate.
Yeah, and we talked about what your organization does. I'm also just wondering, the partnerships of prevention programs here in Louisville, but also Southern Indiana.
Mm-hmm. So there's a great network of mental health providers in Southern Indiana. There's a Child Advocacy Center in Southern Indiana as well. And at Family and Children's Place, we work with lots of organizations. So ECHO, CASA, YMCA, Boys and Girls Club, Center for Women and Families, lots of organizations that are playing a piece and keeping kids safe, doing the preventative work up front, creating environments that are safe and nurturing, providing support to parents and to families, and also a growing movement to educate children themselves, to say, this is your body, this is what is right and what's not. You have autonomy in this. If you feel uncomfortable, these are your steps. Come and talk to somebody, share what is going on. So I think part of the movement, too, has just been educating children themselves to say, you have a voice, we believe you, share your experience.
I think that's so necessary because they're learning what is, what are these boundaries and what are these realities. That's really interesting to hear.
Yeah.
So, what do you think are some of the biggest challenges facing organizations that work in child abuse prevention and response?
Of course, the financing. And every organization that we work with, we're all dependent on state and federal and private support. And there's just not enough money right now to really meet the full need and the scope of the work that is taking place. So I think resources are just a major challenge. Also, so is staffing. There's not enough licensed social workers in the community, aren't enough nurses. There are a number of professions where many industries are struggling to fill those positions, and that also affects the people that work in child abuse prevention and response. So I think, though, there is hope in that, because alongside challenges with funding and challenges with staffing, we also are learning about how to do this, seeing a lot of, again, research, evidence-based practices, learning more and more about kind of what works best in the community, and the data and the information that we have available. So for child abuse, we project roughly 1% of the population under the age of 18 will have some kind of qualifying experience. So for us here in Jefferson County and the surrounding counties, that breaks out to about 2,500 people a year. And historically, we've served about 1,000 kids a year. And there's had been a sense that not everything was being reported, not everything was being shared, that kids were falling through the cracks. So a little over a year ago, the Child Advocacy Centers of Kentucky worked with legislators to introduce something called the Multidisciplinary Enhancement Program. And now all the CACs in the state have access to data in real time of all allegations of abuse. So for our CAC, here in the largest population, that means that they went from seeing 1,000 kids a year to now reviewing 1,000 cases a month. Last fiscal year, they reviewed 13,000 cases and showed 2,700 kids that had qualifying experiences. And that, in time, is going to give us the ability to have better interventions, to respond more quickly, to serve more children, to provide more services. And so while the numbers feel staggering right now, I think the hope is that tomorrow we are going to have such a better grasp on how we can better serve these kids who are one day themselves going to become adults. And this is part of how we break cycles.
So I'm kind of curious, like thinking about that, because that sounds like a big success. Looking back on your work so far, are there any success stories or healing moments that have stayed with you that you'd want to share?
So I don't know that I would call this a success story, but it's one that we're really grounded in.
Yeah,
is an experience that took place at our CAC. There were two young men, two brothers, who alleged sexual and physical abuse, and they also had reputations of that they just got into a lot of trouble, and people felt like they were being deceitful and just using this as a way to kind of avoid responsibility for other actions. And the staff at our CAC really pushed and said, no, you have to investigate this. We have to have a response. They're lying, then the evidence will show it. But right now, we got to investigate. And the caregiver, the non-offending caregiver, was notified and unfortunately let the young men still be in contact with the offender. And on a trip, one of these young men took his own life. And so when the other brother came to our CAC, he wanted to leave behind a button. We have a wall. It's a tree of healing where all of the kids leave something behind to sort of, show their strength that they were there. And he asked to place one for his brother because his brother never got to tell his story. And so that's the power of telling your story and being heard and being believed matters. And so we will never take those buttons down. It is something we share with all guests who come into our building because it's what we're grounded in. We're here to be a voice for kids. We're here to believe them. We're here to facilitate their process and their healing.
In Family and Children's Place, I mean, this organization has an incredibly long history. It was founded back in 1883. That's more than 140 years of service.
Mm-hmm.
So what does it mean to lead an institution with that kind of legacy?
That's a great question. I think it's humbling, but also I think part of the humbling is that, it's a privilege to get to be a part of something that's 143 years old. We'll be celebrating our birthday in the fall. And for over a century has, in different shapes and different names, but always an emphasis on how to provide for families, how to help children heal, how to create safer communities. And there's something just, again, that's beautiful and an honor to get to play a small piece in what I hope will be, the next 140 years of this organization.
And this organization, it sounds like there's so many partnerships. This is a great big effort for such a public health crisis. I mean, what sets it apart?
I think part of what sets us apart is that we have so many partnerships and that we have this range of services where we're providing education, we're providing training, we're focused on prevention, but we're also in the field. We're providing direct services alongside those prevention and intervention. And not many organizations get to live in both worlds, and not many organizations get to have this kind of breadth of services where you are responding to abuse, you're providing visitation services, you're doing the forensics, but then you're also doing the downstream work. You're also doing the real service of prevention where you're working with families. You're seeing the children develop in front of you. You're there, sometimes literally they're working with families pre-pregnancy to help with that maternal care and safer deliveries, and then be there when the baby is born. In the case of HANDS, they work with children for the first 3 years of life, and Greater Louisville Head Start the first 5 years of life. So we get to really see kids grow up. We get to see parents moving alongside of them, and parents really growing into themselves and their role as the leader of that family. It's an incredible privilege, and it's rare for an organization to get to do both.
So before I let you go, for those listening who want to be a part of the solution, what can they do to help?
Please come visit familyandchildrenplace.org. We have information. We're always looking for volunteers, for supporters, for events. We have lots of ways that you can get engaged. And so I welcome the conversation with anybody.
Well, Elea Fox, thank you so much for joining us today on Track.
Thank you so much for having me.
Elea Fox is the president and CEO of Family and Children's Place. She previously served as vice president of philanthropy at U of L Health and held leadership roles at the University of Louisville, the DePaul School, and Buffalo State University. She holds a master's in urban planning from the University at Buffalo and is pursuing a PhD in public health at U of L. On Track is a production of Louisville Public Media. The On Track production team includes Michelle Tyreen Johnson, Alex Biscardi, and Laura Ellis. Our music is by Kojin Toshiro. If you're just tuning in and you want to hear the full show, you can find it now at LouisvilleOnTrack.org or in your favorite podcast app. And let's continue the conversation. Is there something you want to hear about, something that matters to your Kentuckiana experience? Let us know by sending us a text or calling 502-814-TALK or an email at ontrack@lpm.org. I'm Aisha Jaffer, and remember, being kind is free. That's the start of community. Until next time, you're on track with Louisville Public Media.